I'd rather be in Cali smoking Mel, we chillin' in a Porsche. I ain't that fortunate though, my 9 to 5 I push no. Although I want it so bad, my soul is yet to be sold.
Hello and welcome to another episode of Let's Learn PT. Today we're going to be covering another shoulder pathology. This time we'll be talking a little bit about frozen shoulder, also known as adhesive capsulitis. So before we dive into truly defining it, talking about the causes, the related factors, and the treatment, I want to give you an overview so that you have a better understanding of what frozen shoulder adhesive capsulitis is, so that when we dive into this stuff it makes a hell of a lot more sense. Adhesive capsulitis, so adhesive, sticky adhesions, inflammation-based tissue, fibrous, sticky tissue that bounds down the capsule and prevents movement at the shoulder joint. Capsulitis, inflammation of the capsule. So sticky adhesions due to inflammation of the capsule. So this is the capsule right here. It is a literal capsule that encapsulates your glenohumeral joint, your humeral component of your glenohumeral joint, and it encapsulates this shoulder bone right here, keeping the joint fluid and keeping all the joint structures in this capsule. And when it is behaving normally, it has a little bit of give to it that allows us to move our shoulder overhead, allows us to go into internal and external rotation. But due to some kind of pathology, that capsule becomes inflamed and it tightens up and doesn't allow, especially certain motions, of movement. And as that happens, that can be painful and restrictive. So that's how we get to frozen shoulder. So its pure, super wordy definition would be progressive, often painful, loss of motion along the shoulder joint due to inflammation and scarring of the capsule. So like I said, the inflammation causes that scarring, and once that scarring is formed, shoulder mobility decreases and pain increases. So some causes of frozen shoulder would be immobilization. For example, if I have a surgery or I have a fracture in my shoulder and I am immobilized in a sling for a long period of time, a lot of times that can spark that inflammatory process in the capsule and cause frozen shoulder. Rotator cuff tendonitis or subacromial bursitis are two pathologies that oftentimes spark intracapsular inflammation just because of the nature of these inflammatory processes and the nervous system response to the pain associated with them. Stress would be another one. High stress, again, sparking that inflammatory process, increasing the likelihood of the development of frozen shoulder. Trauma, a fall onto the shoulder, that kind of thing, any kind of, humeral trauma where you are A, provoking pain, which is sensitizing the nervous system, and B, provoking pain, which is oftentimes associated with an inflammatory process. And then C, and something that we had to pay some of the most attention to, is oftentimes frozen shoulder is an insidious pathology, meaning that we do not have a direct cause that's like when somebody gets this, they get frozen shoulder. A lot of the times it is more of I was just using my shoulder one day and noticed it was tight, and then over the course of the next few weeks it got tighter and tighter and tighter until I had to come see a healthcare provider because I couldn't move my shoulder into external rotation and overhead. So the related factors, things that we know are correlated with the development of frozen shoulder, are a diabetes diagnosis, notably uncontrolled diabetes. Having glucose in our bloodstream and around our tissues oftentimes leads to different pathological processes. So diabetes is heavily correlated with frozen shoulder. Falls, like I mentioned, if you're falling and you're falling especially onto your shoulder, even if you don't injure it, that is a traumatic process that can cause pain and can spark inflammation. And then females tend to be a more heavily affected population than men when it comes to frozen shoulder. And then I want to talk a little bit about the range of motion loss with frozen shoulder and using that as a way to detect if you may be developing frozen shoulder so that you can detect it and rectify it early rather than waiting and thinking that this is just a random loss of motion and then it's going to get better. So it's called a capsular pattern, which is interesting because a capsular pattern is which motions a joint moves that are most restricted by the capsule. And in the shoulder, it is external rotation first. So if I have a really, really tight capsule, first and most restricted would be external rotation, which is just like this, or 90-90 external rotation, just like that. Abduction, raising my arm out to the side, would be the second thing that would become restricted. Internal rotation, coming in like this, down like this, or behind your back. And then finally flexion, which is just straight out in front. So these would go from most restricted to least restricted, and you will notice that this would feel the most tight, followed by this, followed by this, followed by this. So that's a good way for physiotherapists to detect what do we have going on, how tight is their capsule, could this be a capsular issue. Finally, some of the treatment that we go down, blaze down the path of trying to address and rectify frozen shoulder would be NSAIDs. Obviously, NSAIDs, Advil, naproxen, ibuprofen, is a compound that's going to relieve inflammation. And if we truly believe that inflammation is the spark that starts this pathologic process, NSAIDs can be an early treatment to help halt that inflammation and see how the shoulder is doing with some kind of compound that helps control inflammation. Passive range of motion is the first thing in physical therapy that's usually done, because active range of motion requires those muscles to fire and stresses the joint a little bit, whereas if somebody's fully relaxed and their joint is getting ranged and their shoulder capsule is getting stretched at a light frequency where we're not stressing that capsule and pushing that humeral head into the capsule real hard. It's a comfortable stretch to help alleviate the tightness of that capsule without stressing it and worsening the pathologic process. Then you follow that by active assistive range of motion. Active assist would be like wall slides on a wall, sliding up a wall, cane overhead, where you're guiding with the opposite arm, or you're guiding with using some kind of assistance from a wall, because that, again, you're not totally activating that joint, you're not stressing and stretching that capsule so much, you're doing it in a gentle, controlled fashion to slowly get that capsule to release. Light stretching would go past that active assist when that joint has a little bit more free play, the capsule's relaxing more, then you can get into some light stretching to gain back external and internal rotation. Finally, there is some stuff that they do medically. Capsular releases would be for somebody who has prolonged frozen shoulder who's not responding very well to physical therapy. They'll go in and they will partially release that capsule to allow you to get better motion, and then subsequently do pretty aggressive physical therapy to improve and address range of motion restrictions. And then finally, steroids. They'll do intra-joint steroids sometimes to relieve that inflammation at a very systemic level, more powerful than those NSAIDs. So that kind of covers frozen shoulder, the pathophysiology, the related factors and the causes and the treatment. If you guys want to see some exercises related to relieving frozen shoulder or any kind of demonstrations of what we do in physical therapy, please let me know in the comments below. Thank you so much for viewing. I appreciate it.